Excellent. Welcome, everybody, to this LinkedIn Live. We're going to have a fantastic show for you today. So Mike and I were just catching up. We'll introduce Mike here in a moment for the live broadcast that we have for Healthcare Now Radio. But first of all, excited to be here with everybody. Mike and I were just talking and kind of joking. We've done everything that you're not supposed to do when you're launching a new format. So we changed backgrounds, we changed lightings. Mike is traveling. Change the whole structure of the show, like all in one fell swoop. But very excited. Glad this worked out. Mike, thank you so much. I know you've been traveling a lot, being able to zoom in here and be part of this live stream. So, thank you very much, my good friend there. For sure.
Glad to be here. Glad to be here.
And everybody knows, and you'll hear this when I do the intro of the actual broadcast. So we're going to do kind of twofold here. We're doing a live stream on StreamYard, and we'll have a great time with that for sure. So you guys can see kind of the behind the scenes. We'll run through our pre-show checks and all that kind of stuff. And then we'll go live for 26 minutes. I'll record a 26-minute show almost every single week. That goes out on Healthcare Now Radio and Business Radio X and a lot of other platforms. And we'll record that segment. But you're going to see all the kind of the pre-show, and Mike and I get on here, or my guests and I get on here. We do sound checks, mic checks, and just make sure in visuals. We don't usually do video, so it's kind of cool that we decided to do video this time, and hopefully we'll be able to do this once a month. I think this is a great medium for all of us. We all love LinkedIn, and I know they're building their platform as well in this capacity. So great to be here. And I was hoping to have a beautiful day here in Sarasota for everybody, but the clouds have kind of rolled in. We've got some storms coming in later on. I even have some construction below me in my building. So like if anything could go wrong, it's all set to go wrong, but it's not going to. It's going to be an amazing event. And if you have any questions for us, please just hold them to the end. We'll get to it. Again, we've got to do a 26-minute recording, and then we'll dive over into any questions that we have. And we appreciate, again, we should be able to have these hosted for once a month or so. But are you ready, Mike, for us to move on?
I am ready for us to move on.
Excellent. Well, as we do our pre-show checks, make sure all email is shut down, dingers, ringers are off. And what's crazy is I always tell my guests that, and then half the time I forget to do it. My phone rings, my watch rings, something rings. So Slack is turned off, all that good stuff. Emails off, take pictures. Actually, yeah, you know what we'll do here? I know this is being recorded on this side, but let's even do a recording here. We'll even spin this around for all of our guests and everybody. It'll be a good little show. Woo! All right, here in studio. Perfect. All right. So I'm going to count us down, and we should be good to go. Let me go over to my timer. And again, please hold any questions or comments for the end of the show. We'll record live for 26 minutes. And my normal audience will hear this next week on Healthcare Now Radio. And here we go. So I'll do a countdown. 3, 2, 1. Thank you for tuning in, and welcome to This Just In. I'm your host, Justin Barnes. In these segments, I'll bring you the latest advancements in healthcare, strategy, innovation, and leadership. This week, we're broadcasting live from the This Just In studios on the Healthcare Now Radio Network, and also decided to broadcast live via LinkedIn Live. I hope everybody can hear this broadcast at least once a month. We enjoy doing these types of new ventures, and so we'll continuously add that, again, hopefully once a month. For this episode, though, my 300th episode, we decided to add this LinkedIn platform to our live broadcast because we have a very special announcement. And hopefully I can go ahead and do this here. But I was trying to do my drum roll. Oh, not going to work out right now, I don't think. But I very pleased, very excited, very happy. This Just In Radio Show won the 2024 Podcast of the Year from Swaay.Health at the 2024 Swaay.Health Conference held in Atlanta. And you were there, Mike.
Yes, I was.
I was.
They saw the stream from last week, Justin actually posted a picture of your award that was on the desk.
I know you did. You're awesome. I appreciate that. Yeah, no, we're not sure who even submitted, but that was very cool. We're very happy and blessed and very fortunate and couldn't be more honored or grateful. And thank you very, very much to John Lin, Colin Hong, and the entire Swaay.Health team. You guys are terrific. And for those that may not know, Swaay.Health Live is the premier healthcare and digital health marketing conference in North America. So the award is truly humbling. I would hopefully be able to participate next year, as I know I missed a great conference. I'm sure it was phenomenal. Mike, you were there. Again, great networking and people and learning and education. Yeah, all that good stuff.
Yes.
And for the show itself, the This Justin Radio Show, I owe a very special thanks to certainly all my guests. Mike, you're a very frequent guest. Very cool. One of my right-hand men in my company, Jake Reed, pointed out yesterday, you were on my show for the first time exactly 2 years ago today.
Oh, wow.
Yeah.
Wow.
He was going through all my old shows and making sure they're out on all the different platforms and doing a spot check and audit on that. He's like, Mike Mosquito was here for the first time 2 years ago today. What are the odds?
Glad to be back to celebrate you, my man.
Absolutely. We're going to be celebrating you with your new podcast here shortly, The Buzz, but we'll get to that for sure. Hopefully we'll talk about that a few times. And hopefully at some point over the next couple of years, you invite me onto your show. I'd love it.
Absolutely.
So, but my guests make up the show. I don't usually do a lot of talking. This show, I am going to do a little bit more talking because we're going to be having and hosting a discussion about a topic very near and dear to my heart: value-based care, chronic care management, all that good stuff. I'll dive into that here in a moment, but I really I have a lot to say. Mike's an expert in this field as well, so it's great to have Mike back. He's a very frequent voice on the show, as most of you know. But also, I want to make sure, not only thanking all my guests for my 300th episode, but also my amazing producer, Roberta Mullen, and certainly to the Healthcare Now Radio Network. Launching this show 10 years ago was actually Roberta's idea, and I'm just glad I listened to her. I also want to personally thank Greg Masters, who produced an amazing series of shows while I broadcast live from HIMSS 24 in Orlando 2 months ago. We had a remote broadcast issue that no one knew about because Greg is such a great guy, stepped in with no notice and went above and beyond to ensure my 2 days of live broadcast went off perfectly. So thanks again, Greg Masters. So now on to the reason for this 300th episode. As I briefly mentioned a moment ago, I wanted to host an insightful and thought-provoking discussion about care strategies, value-based care best practices, and how to successfully navigate the future of healthcare. And anybody that's been around me a long time, I know some of my good friends are listening in, Greg Fulton, who hopefully will be one of my upcoming guests as well. I've always kind of carried that moniker of what to do and how to do it, but on how to successfully navigate the future of healthcare. I know it's a very broad topic, a very complicated topic, but if you're taking the time to listen to this show and be in my audience ever, I try to break it down for you, give you actionable intelligence and those kind of components. So we're going to do that again today. But again, I know, value-based care can sound very complicated, and that's why I want to have this conversation, as there are a few simple steps that all care providers and organizations can take to begin this very important and strategic journey. So, but before I go too far, let me please introduce my very special guest and a very familiar voice, healthcare thought leader, technologist, and innovator, as well as a very long-time good friend of mine, Mr. Mike Mosquito. Welcome back to the show, my good friend.
Thank you very much, Justin. And first, I want to say again, thank you for having me back, and congratulations on this 300th episode. You're killing it. You're killing it. Your subjects, your topics. I'm calling in today, and I want to let you know that I'm here in Dallas today at the Texas Regional HIMSS Conference. It's been great. So things that you're talking about, they're talking about here. So you're definitely hitting the stride and the marks that are in the industry right now. So glad to be here. Glad to kick off this show with you. Let's get into it, man. You got it, my friend. I could not think of a better person to have join me today. And again, I think this is all Roberta. I'm just kind of a talking head, but Roberta is always behind the scenes. And I get phenomenal guests like Mike joining. So I love it. Very fortunate, very blessed. But I'm very excited for this show and discuss our perspectives on the evolution of care and specifically chronic care management in our country. I personally like to call it care strategy. And I'm also about to start a thought leadership series on successfully navigating value-based care, but primarily focused on how and where to start engaging value-based care within your own organization. Certainly your own care strategy, which led to hosting of this show today. So before we dive in, Mike, anything you want to add to what I just said and kind of want to walk through in value-based care, CCM? No, I think this is timely. Over the past month, I have been engaged in events and moderating sessions that are hitting on chronic disease management and value-based care. And at Northeast Georgia, we'll get into that in a little bit. How does that align with population health? And it falls right in with these discussions that are happening around the country at all these events you see me touring at with the speakers tour right now.
Absolutely. And I'm sure we'll hear on your new podcast, The Buzz, right?
That the buzz. The buzz.
Love it. So I think for the good news, in 2024, and I wrote a thought leadership piece a couple months ago on this, more care providers are deploying chronic care management programs and remote care programs than ever before. This is to provide superior and proactive care, but also to help augment current and future fee-for-service cuts, which many don't know. Those cuts are slated by CMS every year for this foreseeable future. So I know this last cut of 3.4% was pretty dramatic and drastic, and the future ones are not slated to be that high. However, any cut isn't great. None of us like to, lose revenue year after year and lose revenue opportunities. And so that's why, not only is CCM, chronic care management, great for your patients, great for your care strategy, great to evolve your care, great to ensure that you're, evolving to where care is going to be in the future, but also brings tangible money, additional money to the bottom line. It drives revenue for your practice by care provider. So, have you seen some of that, Mike, out there? What are your thoughts there before, again, I dive in too deep? And
No, you definitely have. Definitely seen some of that out there. Definitely when we talk about the reduction for the physician fee for service that was reduced in this past year, we're seeing a lot of that, especially in our network here in Northeast Georgia, where we have, again, I said, a population health program that's really it's prolific across 14 counties. Again, wow. This is part of what we dig into, 1,600 providers. So we definitely are seeing that traction towards that fee reimbursement, and we're wanting to move even further up that dial, up that stream of using value-based care as a mechanism for getting to our population and to our patients that need it.
Yeah, and I think I want to take a quick moment because you bring up a great point. When I say value-based care, a lot of people say, "Hey, we're not there yet. We're not ready yet." And I'll throw some stats at you later on, where only 7% of care providers in the country are deploying functional chronic care management type programs, CCM type programs, which then again lead into there's even much less than that, a fraction of that doing traditional value-based care. But all I wanted you to get out of this conversation, if nothing else, is that by beginning chronic care, some research on chronic care management, deploying some chronic care management programs inside your organization, inside your care strategy, that is the natural glide path. That is basically a great foray. That is the only step right now that's really, really important for most of us into value-based care. There are certainly a handful of providers across the country that are, that are full risk-based and doing those type of massive capitation groups. That's not what I'm talking about. This is what I'm trying to talk to is the 90% of care providers that have not yet adopted institutionally or functionally CCM type programs. And I just want to give you the confidence to take that very first step. It's not that it's not complicated at all. A lot of great companies out there, a lot of great innovations that can help you, a lot of great support structures. But it's the right thing to do for your patients, but also it's the essential revenue that we need. There's so much revenue being left on the table. And again, I'm going to hit a lot of those stats here in a bit, but it's just, I don't want people to get too thinking this is way too complicated. I can't do it. I'm going to get out. I'm going to retire or just find a way around value-based care. It's not about that. It's about looking at what type of chronic care management can you do with your population based on your specialty. And that's where my thought leadership series will go to eventually. Once it gets in this first couple pieces out there to lay the foundation, I want to go specialty specific to give people the confidence and the comfortableness to move in that direction with chronic care management, which again, naturally will guide you into value-based care. So I want to make sure this is, a low bar for everybody. But let's take a step back. So I want to actually define what is chronic care management? What is CCM? So by definition, CCM is the care coordination that is outside of the regular office visit for patients with multiple, 2 or more chronic conditions expected to last at least 12 months or until the death of the patient, which is scary to think that, and that place the patient at significant risk of death, acute exacerbation, or decompensation, or functional decline. So just that definition itself is quite scary. You're creating a care strategy which is going to keep someone alive. That's basically what that says, because everything else I just listed is all about death and decompensation. So it's really seriously about you taking this very seriously, not only for your practice, but also as a patient, as a consumer. And I'll even go farther. CMS, Centers for Medicare and Medicaid Services, 1 in 4 adults, including 70% of Medicare beneficiaries, have 2 or more chronic health conditions, qualifying them for CCM, qualifying them for chronic care management. That means 70% of Medicare beneficiaries and 2/3 of American population are basically on their way to dying. I mean, I don't mean to be that dramatic, but having 2 or more chronic conditions is a significant life inhibitor for you. It's going to put you on the wrong track in life. You're not going to live to 95 years old or 90 or even probably 85 with 2 or more chronic conditions, unless you really start to take care of yourself at a later stage. So I don't want to be a Debbie Downer, but it's a real, because also think about the health aspects, the quality of life aspects, but also the financial aspects. The number one form or cause of personal bankruptcy is healthcare expenses. And yes, we have healthcare issues with our hospitals and overcharges. There's issues there, but that's not the main. The reason is we have an out of control healthcare financing mechanism, but also we have an out of control society that hasn't really taken a lot of this seriously. But on a positive note, trying to make sure that everybody begins to understand their opportunity for themselves as a patient, feeling better, living better, higher quality of life, doctors making more money, having a happier patient base. Medicare is stepping up, and I'm going to talk about here in a moment what Medicare has done and a lot of the private insurers have done as well. But it's a really important topic because, hey, how does it affect me? If you're, again, a doctor, money, happier patients, less hospitalizations. I'll talk about those stats here in a moment. If you're a patient, higher quality of life, more time with your kids, more time with your grandkids, a better, again, life in general for yourself, save money on healthcare costs. And then again, the government's doing what they can do as well. So if you listen to any of my shows of the past year, you know that chronic care management is a critical component of care that is proven to contribute to better outcomes and higher patient satisfaction. Again, I ran through some of those stats. I'll talk about some more stats there. But Mike, in your experience up in North Georgia, and as you travel around the country, you talk to lots of care providers, a lot of healthcare systems. What CCM success have you seen or that you would point to, or outcomes that you would point to?
I would say I know of several, and a lot of them are around pediatrics. I will tell you, Dr. Sarah Cohen up at Johns Hopkins. We've got Children's Hospital out of Philadelphia, Stanford Children's. They all have chronic care programs, and they are tailoring them towards pediatrics. They're going in strong, and they're developing these strategies around pediatrics and children at their hospitals. I think neurology at Boston Children's, one of them. Dr. Patel, an endocrinologist at Cincinnati Children's Hospital. They have all gone in strong at looking at how to take care of these children early, so that when your 2 chronic illnesses are leading to demise early, they're trying to cut this off early.
Exactly. Amen.
So that's what we're seeing. We're seeing that cost-effective care up front and access to better care up front will reduce that morbidity rate and reduce that amount of death that you're saying we'd see with having these conditions pop up.
Yeah. So and it's in the definition. Like it is. I mean, I hate to be a Debbie Downer. My shows are always uplifting and very energetic and fun, but chronic care management is a real serious topic. I get excited about it because, I've been working on it for so long and actually kind of, I've been fortunate enough through the years leading up to 2015. And there's a handful of us, a group of us of leaders, and you were there, Mike, for sure, that were able to educate Congress, and also advocate to CMS that providing care management services, takes provider time and effort, and thus CMS should reimburse and establish separate payment models in billing codes for the additional time and resources spent on providing care between appointments. Because again, most reimbursement, is still focused on episodic care, in-person care, but now we have, these new codes. There's actually 25 plus care management codes, depending upon your specialty and how you want to look at it, but 25 plus care management codes that have been created over the past 9 years, created since 2015. So phenomenal progress. And I'll go through some. Again, I'm going to do some thought leadership writing on this and do additional shows kind of diving in by care model and by remote care model and by specifically specialties. But, you've got chronic care management and you got the primary. There's 5 CPT codes for CCM. There are 13 CPT codes for RPM, which is remote physiological monitoring, not remote patient monitoring. People think it's remote patient monitoring, but it's actually remote physiologic monitoring. And that's any specialty. Again, 13 CPT codes for RPM. For remote therapeutic monitoring, RTM, we can do 22 CPT codes. There are at least 22 for RTM. FQHCs and the RHCs, unlimited expansion now. So that's exciting. 25 plus CPT codes that we can, you actually address under FQHC and RHC. And again, unlimited expansion also, so you can bill for multiple codes this year with FQHCs and RHCs. Behavioral health, there's 9 CPT codes. Under principal care management, PCM, there are 18 CPT codes for specialists. And then chronic pain management, CPM, 24 plus CPT codes for chronic pain management. So a lot of opportunity for billing. Again, this is the payment infrastructure for value-based care. So when someone says, hey, what are you doing for value-based care? If you're doing anything in the chronic care management area or arena, you're well on your way. That is the glide path. That is the foundation for value-based care in our country. So, and as I noted at the top of the show, deploying these systems, are truly functional and foundational for you, no matter what practice you are. Again, there could be some, acute specialties that don't fit with chronic care management, but 95 plus, 97 plus % do fit some type of chronic care management type of model or remote care model. So just make sure that, you take a step back if you haven't already and begin. And I'm going to link to a lot of resources. We're putting more resources out on justinbarnes.com on the thought leadership section on, how to educate, where to begin, how to start, people that might be able to help. There's a lot of resources I'm going to start putting out there over the next 3 to 4 weeks. Again, that's why Jake Reed has done a lot of great work with me. He posts a lot of this content. It's been phenomenal. So before I go any farther, what is your advice here, Mike? I know we've talked a little bit, but anything you would continue to share about the importance of evolving a care strategy or engaging value-based care?
I do. I think there's an importance in putting an integrated network together so that you have health partners, a collaborative network. What we've done in Northeast Georgia is bring, again, 1,600 providers together over 14 counties with primary service to that patient population, making a mission of it being cost effective, highest quality, preventive measures at the forefront, interventions, and incentives to promote that health and wellness throughout the entire community. So we make it a community. When we say population health, it's a community health. So it's how do we affect those around us? And as we start seeing those communities who are addressing the disparate and those underserved populations, how do we attack them with this population health strategy? It's paramount that you have a mission strategy that's driving you towards getting the right people in the right place, serving them where they are and where they need to be for the right conditions. And so, again, as you see these strategies come through and you put these numbers in front of everyone, Justin, the benefit is they now can see what they should be striving for to have an expertise in their area, because one model doesn't fit all.
That's right. No, fantastic. And for those that may have tuned in a little late, my special guest today is Mike Mosquito. And as the audience knows, Mike is a longstanding industry technologist and innovator for emerging solutions. So, and as I noted, roughly only 7% of care providers have meaningfully engaged chronic care management. So we have a long way to go, lots of opportunity. And what I like to say is there's a lot of money being left on the table for care providers, but that's why I want to do this show. That's why I want to host this series. I want to get the word out there. It's never too late to start. You can start anytime. Just, these opportunities are all just 25 plus care management codes. So, it's a lot of success. So actually, I'll dive in specifically on what I've seen. So for example, the average care provider that I've worked with over the past 2 years that engages chronic care management increases reimbursement by at least $12,000 per provider per month. That's $144,000 per provider annually. Additional revenue to the bottom line. That's significant. So I want to make sure that I talk about those numbers, because people talk about the cuts. When we have, not only does this help augment the 3.4% cut that they may have received from CMS, the fee-for-service cuts, this also, again, like I've said numerous times, gives you the natural glide path into where the future of healthcare is going, into the value-based care structures that are fast upon us and growing every single day. If the money does not excite you, patient satisfaction scores exceed 85% from patients after 1 year that have been doing chronic care management. Patients like it. Patients love it. It's very hard to find somebody who doesn't like or love chronic care management, because they feel like they're cared for. They feel like the team is listening. The doctor is listening. The care provider, the care team is listening. People are listening. People care. It's not just once a year you go and see your doctors, or once every 6 months. It's continuously. CCM patient hospitalizations decrease average of 25%. 25% reduction in hospitalizations. The average hospitalization, I think you can debate depending on where you are in the country. We know this, it changes by community, but $12,000 per hospitalization. So if you can decrease, but the average patient, chronic care patient, I think might present themselves around 3 times a year to the ER.
Mm-hmm. Right.
So, you can look at those different numbers. That's a lot of cost savings. When you have, 100 million beneficiaries or so, just think about the cost savings across. That's why we're investing so heavily in this. Think about how many people. We have a $4 trillion healthcare system. And I want to say roughly 85% go to chronic conditions overall. So it might be as high as 90%. I'm not sure the latest stat, but nonetheless, significant amount of money that we can begin. And again, people say, well, I didn't get into healthcare because of the money. Well, think about the care quality, the patient satisfaction, because that you did get in for, because you want to care for your patients. So got about 2 minutes here, a minute and a half. So this is a real game changer in patient care. And again, it's the foundation for value-based care and where the future of healthcare is going and what the future of healthcare will be built on. And I say it's like to be it's an easy layup, I like to say, for providers. And that's why I wanted to host this show. So anything that you want to add to that, Mike, before I begin to wrap up the show?
No, Justin, I just think you've put this in a nutshell for folks. The incentives and the numbers are out there for those that have moved down this path. Things like the clinically integrated network at Northeast Georgia, the HP2 program, that's a physician-led integrated network with over 480 providers, provides that care. It's driving towards those numbers to reduce those rates of morbidity inside our population in the rural settings. And so delivering that care takes coordination. It takes physicians, it takes operators and operational leaders coming together and understanding this network is for their community. And getting there is not something that happens overnight. Most people just, like you said, sticking their toe in this. These programs are here to help drive better decisions for the population and for the hospitals themselves. So I hope we keep this initiative moving forward. I'm actually at an institution that believes in it wholeheartedly for our community. They're putting their initiatives where their heart is, and they're putting it back into their communities.
Yep. I love it. Very, very well said. And we'll keep up this, this initiative, and we'll absolutely, keep up the push here and have you join more of these discussions, Mike. You're on the front line of this. And that's, again, why you were terrific and to have on the show today. And in healthcare, I wrote this earlier in the year, CMS and the private payers, we've really hit the tipping point of that. We're not turning back. I mean, this is the tipping point of these programs are moving forward where there's no turning back. More money than ever is being spent in chronic care management and in value-based care. And only next year in 2025, it'll be more. In 2026, it'll be more. The White House actually, in part of the president's budget, just announced, more value-based care pro models that will be endorsed, but also some virtual care models, continue to move down that path. So everybody's all in. Congress is all in. The administration, the White House, everybody's all in on this. And I think it's just really important to make sure that, so when I go into a health system or I go into a practice, that I educate the guys, this is the momentum. This is where the everybody is going. This is where again, Congress, administration, White House, make sure that you're evolving with it. And a lot of people do. And this is, I want to be a very upbeat and happy person. We've got, at least 7% have mature chronic care management models. We have 93% of the way to go. And I'm absolutely in to help get us there and educate and do more shows like this. Again, it might have, more outlets coming around what I'm going to do with some of my thought leadership. And we got some really cool questions coming in as well. So I look forward to more discussions on this for sure. Please join us. I'll hopefully do this again once a month on LinkedIn Live. My radio show broadcasts every single week as well on Healthcare Now Radio. But again, thank you for joining us today. Mike, thank you very much again for joining us. You've been a phenomenal guest as always, and your voice is always welcome on the show.
Thank you very much, Justin, for having me.
You got it. And I truly appreciate everybody taking the time out to join us and certainly joining us for this 300th episode. Thank you very, very much. Please tune in weekdays at 2:30 p.m. Eastern, 11:30 a.m. Pacific. As always, you can track me on LinkedIn at HIT Advisor or Justin T. Barnes at LinkedIn as well. And use the hashtag ThisJustinRadio so we can respond to your comments from the show. If you missed any of this episode or want to hear more, all my shows are posted at Apple iTunes, SoundCloud, Spreaker, iHeartRadio, and TuneIn, and soon on YouTube. Thank you very much, everyone. Have a great rest of your week. Awesome. We are done with a live broadcast there for This Justin Radio. And now we'll go back to our LinkedIn live stream. Got a great couple questions here. Thank you very much. Some really cool thumbs up. Does it make sense for providers to negotiate VBC contracts or pursue existing VBC models at the outset? Fantastic question from one of the audience members. It does. It actually, it does make sense to at least understand what your payers can offer you. You'll see they very well may have CCM type of models, RPM reimbursements. CMS obviously has all that documented out very well. I've actually posted that at justinbarnes.com. That's actually out of my site. But also, you'll see you want to see what your payer in your community specifically offers you. They may not offer it to everybody, but you see what's available to you as a provider. How is it available to your practice, to your entity, to your organization, to your health system? But absolutely, it's a great idea to at least ask what's available and then maybe negotiate. And there's a lot of great resources out there. There's a lot of great free resources out there to see what other organizations are doing. And then talking to your circle of peers. I don't do anything without talking to my network and my circle of peers in healthcare. I think you should, that's, a great opportunity as well. Getting some of these certainly these doctors that have engaged value-based care, they've engaged chronic care management, get some expertise from them. How has it gone? What are the pitfalls? How can you successfully navigate it more quickly out of the gate? I think that is all great advice. What would you say there, Mike?
No, I agree with you. You got to navigate out of the gate. That's why Northeast Georgia moved to that model. We've doubled down on it. You've been published. Dr. Mimi Collins, our Chief Executive Officer for Longstreet, talked about focusing on this care. Dr. Rios and Health Innovation talks about population health and doubling down on making sure contracts are in place up front, making sure that we're thinking about this across the entire executive team, physician, clinically, operationally. It's all coming together to make sure providers negotiate these contracts together so that no one has a got you moment, because that's what catches you in trying to move towards a better model. So
true. So again, baby steps are fine. Just doing the research. I'd congratulate you for being even listening to this conversation. And, as a starting step, as a stepping stone, that's great. So you hear this conversation, then you go off and you might ask your payers, hey, what's available to me today? What might be available to me later on this year? What might be available to me next year? Begin the dialogue. And there may not be anything yet, but by you asking that question, it very well could come back in 3 to 6 months. Hey, we're starting this new program and we want to roll it out to 100 doctors, 100 providers. Would you be interested in being one of those 100 providers? Absolutely. Maybe part of a narrow network or something. Who knows? There's lots of opportunities that you might be able to participate in and join. And also it doesn't have to have downside risk. Most of these models are all only upside only. So that's a significant benefit. There's no, you're not going to lose any money. Even with these, CCM type products and services that you can partner with and buy, very low costs, and the ROI is insane. The average ROI. So the average ROI that I've been a part of in the last year has been ridiculous numbers. 5,000% ROI, 10,000% ROI, 3,000% ROI. It's pretty significant for the $500 or $1,000 they might spend a month. They're getting back 10x that or more, much more in a lot of cases. So it's really a no-brainer. I don't like that term too much, but doing chronic care management is a no-brainer for lots of reasons for organizations and care providers. Again, patients love it. Extra revenue, decreased hospitalizations, improved care. I think it's hard to show any stats or say, hey, we did care management and all those patients trended downwards. Obviously, 1 or 2 patients could have a bad episode. That's not nothing to do with care and care management. That's just human nature of health. But I've never seen a stat where they went off and deployed a mature CCM model and all the patients got sicker. It doesn't happen. Only money's to be made and patients get better. So, it's a great avenue for a lot of people. Any additional questions, please feel free to post them. If not, again, many more episodes will be coming. I love this outlet on LinkedIn Live. I want to say, again, special shout out to Roberta Mullen. She was fantastic for presenting this platform to me. Jake Reed, who actually helped me get the studio ready here. This is a live background, a real background. The storms are rolling in. Thankfully, I prayed and the big thunderstorms stayed away about 3 hours. They'll hit us in a couple of hours. But we will do this again. This was a blast. Love the engagement from the audience. We'll post this on YouTube as well to get that content building there, because Healthcare Now Radio, we're shifting a lot of our content onto YouTube as well. So find me, LinkedIn, Justin T. Barnes, on Twitter, HIT Advisor. Mike, what are your hashtags?
Hashtag the buzz, hashtag the recap, hashtag Mike Mosquito. Come get it.
Man. Love it. And you'll all hear Mike on my show. Mike's a very frequent voice. He'll absolutely be back. He's one of my best friends, one of the smartest guys in the industry. And I'm thankful and grateful to have you here, Mike. And I will tease my next show. I'm hoping to get one of my good also friends, inside expert Greg Fulton, joining. Greg has been a good friend of mine for now almost 15 years or so. One of the best policy guys and strategic value-based care minds in the industry. And I'm hoping he'll be able to join one of the upcoming episodes, and we'll do a LinkedIn Live just like this. He's a character just like Mike is. So we'll all have a great time. But thanks, everyone. Have a great rest of your day. Thank you. Bye, Mike.
Bye, Justin.